Hi, my name is Milad. I'm an F1 doctor working in England and I've been in F1 for 8 months now. I'm making this video as a lot of final year medical students are finding themselves deployed as F1 doctors much sooner than they were expecting due to the current crisis the NHS is facing, battling the coronavirus. So I thought I'll make this video just to draw upon my own experiences and things I'd have found useful to hear as a final year medical student. I hope you find this video useful. My first advice would be to try and make a good effort to get along with the team you're working in. That's because as an F1 doctor, you're always going to be working within a team, and things will be made easier or harder for you depending on how well you get along with your team. A lot of things that go wrong often go wrong because of human factors, such as communication going wrong, and that's less likely to happen if you have a good working relationship with the people you're working with. So try and make a reputation for being reliable. You can do that by being on time, making sure you're organized, not forgetting things, and it even helps sometimes to get there a little bit earlier so you can get your mindset ready, have a coffee and relax before the stress of the day starts. My second suggestion would be to speak to somebody who's been on the rotation that you're going to and finding out exactly how the department is run and how consultants like things to be done in that department, as this can differ between different consultants. It can save you having to find this out through experience yourself, and can make the transition from being a medical student to an F1 more seamless. I understand this isn't always possible as you might be moving to a really far away hospital, but being friendly in the mess with other doctors can help you and go a long way, to be honest. Thirdly, I would highly recommend that you keep your phone charged up at all times while you're working, as there's nothing worse than having your phone dying on a shift and you not being able to use any of the apps that you would normally use to make your life a lot easier. Nowadays as well, your seniors are often contactable by mobile phone, and if your phone dies it can be a lot more difficult to be contacted, as the current bleep system that we use in most hospitals isn't always the best. People will bleep and then get busy somewhere else and get called away, so it's not always the most reliable way to be contacted. Fourthly, there's a few mobile phone apps that I would recommend to make your life a lot easier as an F1 doctor. The first of which is the BNF, which contains most of the medications that you'll be prescribing and the dosages and indications and side effects. You'll probably know the BNF anyway, you'll be used to using it throughout medical school. The second big app that I can think of is Induction. Induction is basically a database specific to your hospital that will show you the numbers for different people like cardiologists or neurosurgeons or wards in your hospital, and it saves you having to ring switchboard or ask people what the number is. Third of all, Microguide is going to be a very good help for you while you're on your shifts. It basically will download the antibiotic policies specific to your trust and show you very quickly what you need to prescribe for what infection. And fourth of all is my own personal favourite. It's one that's been recommended to me by a colleague, and it's called PocketDr. It's available on App Store for $3.99, I think. It basically shows you many of the common presentations in emergencies and will show you the plans for each one with a quick tick box next to each thing, so you can tick them off as you go along. However, do bear in mind that this does not replace your trust's guidelines and policies, and those should be followed in the first place. Now, to get on to a very important point of self-care. Self-care is a vital thing in medicine. You're in it for the long run. It could be 40 plus years depending on when you finish medical school and when you decide to retire. So it's important to see it as a marathon and not as a race, and make sure you don't burn out. While this can't always be prevented, you can do things to help reduce your risk of burning out. So making sure you've got enough sleep, making sure you're eating a good diet, making sure you're hydrated, having a social life outside of medicine, and just keeping up with hobbies in general, for example. So for me, I quite enjoy doing Muay Thai, and I train that twice a week when I can, although it's been impossible to train with the current virus, of course. Now, remember that you're not expected to know everything. There's a reason you don't come out of medical school being a consultant already, and there's a reason why some programs are 10 years or more in length. So make sure that when you recognize you're outside of your comfort zone, that you inform a senior. Before reaching that point though, it's always good to make sure the basics are done. So if your patient has chest pain, for example, having an ECG done already, giving them pain relief, doing bloods, etc. These are things you can do to make your senior's life easier and make you a better doctor too, so that when they come, even if you don't know the answer, you've at least done these things in place and put them in place. Document, document, document. You should have the mentality that if you didn't document it, it didn't happen. This is because you might be asked to answer for why you did something a certain way years down the line when you'll have long forgotten about what you did. And so your entries in the notes will often be the only evidence that you have. So documenting efficiently and documenting appropriately are two things you should be doing to make sure that you always justify what you're doing. So that includes discussions with patients, families, discussions with the patient themselves, advice you've sought from seniors, discussions with other specialists. These things will all need to be documented, as if things go wrong, then at least you can show that you've asked for help. Make sure you know how to do SBAR properly. So if you don't know, SBAR is the way that we do handovers in medicine and the way we convey information very quickly and effectively. It's a method that originated from the military, and it's very useful when you have limited time and when you're speaking to a stressed out doctor on a busy night shift. You'll find that this will help you avoid somebody being a bit annoyed with you because you're rambling on the phone. So you should have gone through this in medical school, but if you haven't, that's okay. You can look it up online and just make sure you're familiar with giving this kind of information over the phone very quickly. It will save you. If you ever feel out of your depth, just go back to your basics. You know a lot more than you think, and by going through an A2E assessment, no matter where the problem originates, you're often able to narrow it down and treat problems as they arise, in the order that they will kill the patient. So for example, if you find out that the oxygen saturations are low, you can give them oxygen if appropriate. If you're finding circulatory problems, you could give them fluids. There's a lot you can do for any patient, no matter what. And remembering that is important. And when you feel overwhelmed, it's important to take a step back and just reflect and think about that. You will be able to do more than you realize in that way, rather than panicking. This is a scary time for all of us, and unlike anything we've ever dealt with in the NHS before. But through hard work and cooperation, we can beat this virus together. It's important to remember that you have help on hand, you have support, you have seniors, you even have the BMA who provides support over the phone to people. And whenever you feel overwhelmed, make sure you prioritize yourself and have a talk to your friends or your supervisor and just make sure they know what's going on. You don't need to suffer quietly. I hope this video has been useful. I'm happy to answer anything in the comments that people are curious about. And I would suggest you like the video if you like the video, and to subscribe as well, as I'll be releasing regular content on this channel from now on. Take care.